Well, at NIDDK, many of the diseases in our research mission exhibit dramatic health disparities. These include obesity, type 2 diabetes, which place individuals at high risk of many other conditions and complications like kidney disease, while increasing risk for premature death and lower quality of life. About a third of U.S. adults have obesity, and rates are significantly higher among Hispanics, African Americans, Native Americans, Pacific Islanders, and many minority groups. About 12% of U.S. adults, or 30 million people, have diabetes. 90 to 95% of these are caused by cases of type 2 diabetes, which again disproportionately affects certain racial, ethnic, and socially disadvantaged groups. Now, another 84 million U.S. adults, or about 1 in 3 adults, has prediabetes. These disparities clearly point to a need to achieve health equity in preventive services. At NIDDK, we address health equity in preventive services by funding research. In our studies, we strive hard to get broad representation of diverse populations, so we're more confident that the research finding and recommendations will hold true for the populations that are most affected. For example, the NIDDK-led Diabetes Prevention Program, or DPP, recruited heavily among African Americans, Hispanics, American Indians, and Asian communities, and showed that structured lifestyle changes designed to promote modest weight loss can delay and potentially prevent the onset of type 2 diabetes in those at high risk and people from those backgrounds. NIDDK supported translational research led to an adaptation of those interventions that form the basis of the congressionally established National Diabetes Prevention Program, which is being disseminated nationwide by the CDC and CMS. Achieving health equity in preventive services would improve the overall health of socio-economically disadvantaged communities where rates of obesity and diabetes are highest. Health equity approaches could transform access to evidence-based services, affordable diabetes screening, and feasible treatment options that align with people's cultures and values. This requires strong collaboration with communities, healthcare systems, and researchers. Now, from a research perspective, it's imperative that we develop and test new approaches to prevention, especially interventions that could be used in under-resourced communities, including the innovative use of technologies. Well, I believe achieving equity in preventive services will reduce disparities in diabetes and obesity and help prevent their complications. Therefore, improving uptake of evidence-based services in diverse settings will improve many health outcomes so people have a better opportunity to live longer and healthier lives, regardless of income, where they live, or racial and ethnic background. These outcomes are important for our nation and motivate the work that we do in NIDDK.